Well, to a health alert now. By the age of 50, 3 out of 4 women struggle with fibroids, non-cancerous tumors in the uterus that can grow up to the size of a watermelon. That percentage is even higher in black women. Doctors don't know why. NBC 15's Karis Harmon joins us now. Karis, you're learning women in the South, especially black women, have higher rates of hysterectomies due to lack of access to OB/GYN care.
Yeah, that's right. Dr. Jeff Fay says fibroids are not life-threatening, but get this. He says often women unnecessarily get hysterectomies to treat their fibroids, and there are other ways to get rid of them. Fibroids are non-cancerous tumors that make a home inside of the uterus, causing excessive bleeding and pain. Dr. Jeff Fay is a gynecologist and pelvic surgeon at Premier Women's Health. He says oftentimes they're hereditary and go unnoticed.
I had a case not long ago of somebody who had lost 15 pounds when we did her surgery because her uterus was that big, and she had been walking around like that.
Women, especially in rural areas of our state, don't always have access to OB/GYNs like Dr. Fay. According to the Alabama Department of Public Health, 33 out of 67 Alabama counties don't have practicing OB/GYNs. As a result, women rely on their primary care physicians for diagnosis, and Fay says they're sometimes told to get hysterectomies.
Not everyone needs a hysterectomy. I think access to care is extremely important. And what happens is if you don't have access to care, then you have a delay in diagnosis. And even though this isn't a cancer, a delay in diagnosis can lead to a larger uterus that won't respond to alternative therapies, such as medications, an IUD, an endometrial ablation, different things that can help treat bleeding or shrink the size of the fibroids.
And why black women have a higher chance of getting fibroids? The answer is still unknown, and doctors are working to find out why. But Dr. Fay says get checked at the first sign of discomfort because early intervention is most effective to reduce the likelihood of hysterectomy. Greg?